All right. I'm a day late and a dollar short in this one here. It's 4:30 in the afternoon. It's still the March 7th, 2024, the Weaver John C. Roseman, California. No Diary of the Griever on this one. Maybe a little bit of a zombie situation here. And how about being totally pissed off? Let's just say being totally pissed off. I mean, hearing rumors and whispers about this damn thing, but really didn't realize this was going to be coming out this way. And I'm asking a question here. What the hell is going on? Okay, why am I outraged? Okay. Came across a PBS article concerning about cyber attacks hitting the healthcare industry. I heard stories about this one last year, but I really didn't. It didn't sink in. It didn't sink in. Not until PBS was revealing a story about a major attack to happen in February of this year. Was United Healthcare's systems, um, not the medical information system, but the payment. There was this company called Change that they bought out, United Healthcare. And it affects a lot of the patient's information, and not to mention payments, and doctors' payments, and hospitals' payments. This got hit. Ransomware situation. It's left the healthcare industry smarting on this one. Royally smarting on this one. That people are freaking and having conniption fits over this one. And rightfully so, especially when the patients can't get authorization for services or can't pay bills at this point over here. And the doctors are having problems getting bills, and hospitals are getting bills. Can't get payments, but they're trying to weather some of this stuff out. But this was a major cyber attack that hit. However, PBS said it was relatively unknown. Well, maybe so, but to the general public, they wouldn't know about the change industry that healthcare, United Healthcare, bought to help facilitate payment and information distribution and authorizations, apparently, for services rendered. And this is terrifying. They were talking about healthcare getting nailed last year. I wasn't even paying attention to it. I should have been. Things like this should have been attracting my attention more and more because I had been in the healthcare industry on the information processing end. We dealt with our own direct. I didn't know anything concerning about the payment situations. I only understand about the authorizations coming from one particular company's utilization review management. And they didn't have it outside or farmed out when I was working there decades ago. So I know things have changed a great deal. But I had also been under United Healthcare a long time ago before I hit the big K. Before I was actually qualified to use the big K. So here I am, dealing with the big K. Do I like it? I can deal with it. I can work with them. Can they work with me and deal with me? An erotic mental case here. You guys been following me left or right. You understand that I got issues going on. I had kept this stuff under wraps. Anything concerning about my own damn physical and mental health, I kept it under wraps. I didn't want anybody else to go nuts. Not even my own damn family, but they already know I couldn't stand a medical establishment, and they knew that. But what's the problem with this situation here? I'm in a healthcare situation that's going to try saving my ass one way or another. And I have to utilize what I can. But even with this big system that they have, it's also probably potentially subject to cyber attacks. United Healthcare is just as big. I mean, they've got several outfits out there that keep swallowing each other left and right. Play this damn war game over the past 30 or 40 years of who's going to topple each other, who's going to buy each other out, merge out and become this one mega behemoth to scare the crap out of people left and right. that makes them right targets for cyber attacks. Screw the damn small ones. You go for the larger ones and try to crash them one way or another, either by stealing medical data that may be useful to the patients by holding it for hostage, or payment systems and authorizations. Why? Just to see if you can crash a system one way or another, either for a joyride or you're trying to find some kind of financial incentive. Scares the hell out of me if I'm going to be going over to Kaiser or using their systems, whether or not if somebody's going to be slipping in a Mickey into their systems for authorizations, and watch it go hell in a handbasket. And I am going to be nuts over that one because this is going to be affecting. This is going to be affecting a hell of a lot of us who are using this program. It's scary as hell. So now I got to worry about this crap. Kaiser will probably reassure me that their systems are safe. I'll probably have the customer service agents tell me that you're fine, Mr. Weaver. We're protected. We have no issues with it. Yeah, how come I'm still feeling like we're going to be getting our asses kicked on this one? I still feel it. I should have been feeling this a long time ago. But I tried to give it the benefit of the doubt. I tried to think that this is going to be okay. That I don't have to worry about this damn thing. Now I got to worry about it. I'm surprised nobody else out there in social media had been talking about this damn thing. I mean, if it's been out there for months, where was independent media on YouTube or anywhere else been talking about this damn crap? And if this was going through Congress, how come we didn't hear about it in the general public? Or am I already that dense? Oh boy. There had to be subcommittees about this one in the Congress on this one. It had to be. There had to have been. What I'm looking for in the search engine right now is whether or not we actually had. Okay, let me see. I need congressional. Get over there. Hearings. Let me see. Okay, last year. Last year, okay. And people just put a blinder on this one. But back in March, according to C-SPAN, there had been a congressional hearing about this one. It was posted on March 16th, 2023, according to C-SPAN. What I was looking for right now is transcripts for this damn thing. But they have it. They have it out there. It's too bad they didn't have. Okay, so basically, we're talking about it. At least in one particular episode. It's too bad I didn't have a PDF on this damn thing. I would love to have the PDF on this one. I'd go over it. But they don't. They don't. So it is out there on public air, on public airways from C-SPAN regarding this. The only time they have it? 3 days ago, the HA's Home Health Services were talking about this. Health and Human Services were talking about this. Dated a couple of days ago. They were aware, the Department of Health and Human Services were aware Change Healthcare was impacted by a cybersecurity incident in late February. Recognizes the impact this attack has had on the healthcare operations across the country. First priority is to help coordinate efforts to avoid disruptions to care throughout the healthcare system. And regular contact with the leadership. I'm paraphrasing a few things here, but this is the public statement that they're doing it. Oh, we know about it. We're trying to do everything we can about the damn shit. So basically, we got the FBI involved, cybersecurity, White House, and other agencies trying to track this shit down. Okay, Medicare is getting involved. Assist providers to continue to serve patients. Will continue to communicate with the healthcare community and assist appropriate. Providers should continue to work with all their payers for the latest updates on how to receive timely payments. You know, how the hell it's going to be affecting me, though? I need to get this thing PDF'd. If I'm going to get stuff, I'm going to get PDF'd. I don't have a printer to print up huge volumes of paper, so I have to store it on volumes of flash drives of PDF. But I need this information. I need this information because this is important. It concerns me because being a patient of Medicare, broadcasting that one because of disabilities happening. And even though I am with the big K, how is the authorizations going to be handled? Well, usually through their own doctors and internal staff, I guess, on that one. But payment is a different story altogether. But this has to be important. This has to be. And I can't say otherwise on this one. This may be affecting Change Healthcare is the company, as I said before, United Healthcare bought to handle their part of the authorizations, but the payment situation's happening that they get from other sources to pay the doctors and hospitals, not to mention payment from the patients. But the patients also need this information because if they don't have the authorizations, they can't get the services necessary for their own health. And this is what's scary. Because now we got to be worried about this damn crap. We have to be worried about this damn shit. Because this is scary crap happening here. Which I'm going to be putting a virtual head slap on the independent people out there in so-called social media, or shall I say so-called independents of social media, who should have been picking up on this damn thing instead of talking about the politicians going ape because they're not being worshipped enough, or any other kind of nut job out there who thinks that Christians should be followed, or any other kind of bullshit going on. This is serious shit. The other stuff is basically you need medications and a straitjacket for it. This is affecting pocketbooks. This is affecting human health, lives. They should have been talking about this more and more. They should have been doing something about this more and more. But no, I'm sorry, they're not doing that. Why? Because how dare you say something like that? How dare you say something in the form of challenging people like this? Okay, we have people who are working their asses off and may or may not have the proper health insurance, but if they do, you know how much the premiums would cost, how much the co-pays are, how much the out-of-pocket is, or whether or not you're actually able to afford an ER visit just without a out-of-pocket, without insurance. Some people have declared bankruptcy or just saying, I can't pay it. What are you going to do about it? Take it to collections. Well, can we arrange for some kind of payment system here? Some healthcare professionals are like, no, we want now, before we see you. Well, I'm sorry I can't do it. Well, I'm sorry I can't see anything. See you. I think there are rules and regulations. We've got federal laws that prevent this. They have to be taken care of. The people have no choice. They go to hospitals, and hospitals are the ones absorbing the cost necessary for just an urgent care visit. If somebody's using the hospital as a constant urgent care, that's a drain in resources right there. Past 40 years to this point, I've been seeing that more and more. When people can't afford the healthcare systems, they use the hospitals more and more. Doctors would charge too damn much because there's not enough insurance to cover these guys. And then you have the hospitals going on to bankruptcies or trying to consolidate. The other doctors trying to consolidate their, or just leave the state or leave business. Period. I've seen hospitals who have been there for maybe a few decades, even before I was born, ended up being sold off to another larger corporation or just turned into nothingness. And this scares me because I'd seen how a trauma center in a great metropolitan area of Southern California turned into a laughingstock of the country within decades because prices for medications and medical procedures and doctors' billings and hospital billings and corporations out there want more money. Freaking nightmare. And it still is. I'd seen how expensive just an office visit can be. Sometimes $800-900 for a pop, depending on which particular doctor you're seeing, which particular specialist, or for what kind of services are you kind of getting. And sometimes, if you don't have the money, are you able to do a health plan, actually a health payment plan with them? Sometimes they'll work with you, and sometimes they say, no, sorry, you're on your own, go to the hospital. And then the hospitals will try to get the information necessary, and if they can't, well, they'll treat you as indigent. But they still are required by law, federal or state, or probably both, to at least bare minimum, bare minimum. If you can be treated in urgent care, fine. But if you're treated in the main emergency room for things, hey, charge an arm and a leg. How would you like to be charged? Instead of getting like a $5 or $6 tube, or maybe a $10 tube of Tylenol, they'll be able to take care of some aches and pains and maybe some fever. They'll charge you $25 a tablet. So I remember a long time ago, they may be worse than that right now. They may be worse than that. Just for a Tylenol, $25? markup. I mean, they've been talking about the cost like this stuff for 40, 50 years, maybe worse. Hearings about it constantly. Bills being passed or rejected left and right. Just trying to get the costs down. If that wasn't bad enough, you now have the digital age of today of cyber attacks. Your personal information being hacked, sold, your financial information captured, hospitals being captured, and then you got ransomware. And then the hospitals have to absorb the cost or go to the insurance companies that they go with. And maybe sometimes the insurance companies will say, well, I'm sorry, but that's beyond the policy here. You're going to have to absorb it or else bill the patients higher. Now we're dealing with this. So how are we supposed to deal with this? How we as people have to utilize our healthcare system, the companies we have to go through. We're sure as hell ain't millionaires, though we can actually pay for services out of pocket. So we have to go through insurance companies. We have to use the PPO policy, or at least if we're really on a dime and a budget here, we have to go through the HMO. But even these groups are subject to cyber attacks. Even these groups are subject to economic whims and changes in the air. And how much they're taking out of your paycheck just for that. Or out of your pocket when you have to keep paying them every month. Even COBRA policies. You leave a job and you still had health insurance. They're supposed to, the employer was supposed to offer you a COBRA package, a continuation for 1 year until you found another insurance company to continue the courses of treatment that you're still obtaining. Have coordination of benefits. And when you found another insurance company to take over and you find a doctor, or maybe the same doctor has the insurance that you just selected, maybe you're lucky enough on that one. What if you're not? What if you are not? Then what do you do? And while you're wrestling with this situation over here, here comes out of country cyber attackers. Oh, goody, now we get to get into this particular computer program over here and screw everybody else up. Millions coming out of this one. And yeah, they got millions out of it. They get to be tracked, but by then they've already ditched the ISP and their history. We live in scary times. We think technology is so damn convenient, but it's got pitfalls left and right. So how are we supposed to deal with this? The pitfalls of having communication devices like this being tracked left and right. We can try turning the things off, but the things that we cannot do is protect our own identity, protect our own selves. Even phones like this can be hacked very easily. So this is what we got to deal with. I'm not going to say it's just a thought. Welcome to reality. Scary, ain't it?